Loneliness is now classified as a public health crisis in 14 countries. The research connecting it to early death is not disputed. Chronic loneliness raises the risk of dying before 60 by 26%. It damages the immune system, accelerates cognitive decline, and produces measurable changes in the brain indistinguishable from chronic pain. You feel lonely the same way you feel a broken bone. The body registers it as damage because, for most of human history, it was. And yet, there are people alive today for whom loneliness as a chronic condition essentially does not exist. Not because their lives are easier, not because they have solved something, because they never built the conditions that make it possible. This is not a video about connection tips. It is not going to tell you to put your phone down or join a club or be more vulnerable with people you trust. This is about a structural problem, one that was engineered into modern life so gradually that most people living inside it have never seen it from the outside. The people who haven't built it are still visible, and what they are doing looks almost nothing like what we tell ourselves connection requires. Start with what loneliness actually is, not the feeling of being alone. That is solitude, and it is neutral. Sometimes sought, sometimes restorative. Loneliness is the gap between the social connection you have and the social connection your nervous system was calibrated to expect. It is not a mood. It is a biological signal. The same system that registers hunger, thirst, and physical pain monitors your social environment continuously and sends distress signals when the quantity and quality of connection falls below a threshold your body considers safe. That threshold was set a very long time ago. In an environment where your survival depended entirely on remaining embedded in a group of people who knew you, needed you, and would notice if you disappeared, the nervous system that sounded the alarm earliest survived best. Loneliness was not weakness. It was early warning. The Hadza of northern Tanzania have been studied continuously since the 1960s. They are one of the last populations living in a way that closely resembles the social architecture of pre-agricultural human life. Small bands, typically 20 to 30 people, moving together across a shared landscape, sleeping in proximity, spending most waking hours within sight and sound of people they have known their entire lives. Researchers who embed with Hadza communities for extended periods consistently report the same observation. There is no word in the Hadza language that translates cleanly to lonely. The closest available concept describes a different condition entirely: the specific discomfort of being separated from your group during travel, a temporary state expected to resolve. This is not because the Hadza are emotionally simpler. It is because the architecture of their daily life never produces the gap that loneliness is designed to signal. The alarm never fires because the condition it monitors never occurs. Compare this to the architecture of a standard modern life. You wake in a separate dwelling. You travel to work in an enclosed vehicle or a crowd of strangers you are socially forbidden from engaging. You spend the majority of your working hours in focused individual effort, monitored by performance metrics. You return to your dwelling. The people who know you best live elsewhere. Some of them live in different cities. The interactions that constitute your social life are scheduled, bounded, and increasingly mediated through a screen that your nervous system cannot fully process as real human presence. You are, by the biological definition, chronically underconnected. Not because you lack people, but because the form the connection takes does not match what the nervous system was built to receive. In 2015, a research team led by social neuroscientist John Cacioppo published findings from a decade-long study tracking loneliness across populations in 12 countries. The data showed that loneliness was not primarily correlated with the number of social interactions a person had. It was correlated with their sense of being known. People surrounded by colleagues, family members, and active social lives reported profound loneliness when they felt that none of the people around them were seeing them clearly. The nervous system is not counting contacts. It is assessing depth. This distinction matters because it explains something modern solutions consistently miss. Adding more interaction to a life built around shallow contact does not address the signal. The body is not asking for more people. It is asking for a specific kind of presence that the architecture of modern life systematically produces less of. The Tsimane people of the Bolivian Amazon live in communities where approximately 90% of time is spent in the physical presence of other people. Not interacting constantly, present. Working nearby, resting in shared space, moving through the same physical environment. Researchers studying Tsimane cardiovascular health, initially focused on their dramatically lower rates of heart disease, found a secondary result they had not anticipated. Rates of depression and loneliness-adjacent psychological distress in Tsimane communities were so low they complicated the study's baseline assumptions. The instruments used to measure psychological well-being had been calibrated against Western populations. They needed recalibrating. The Tsimane were not happier because their lives were easier. Life in a Tsimane community involves significant physical hardship, resource scarcity, and the kinds of interpersonal friction that exist in every human group. What was structurally different was the baseline. The resting state of a Tsimane life includes a level of passive co-presence, simply being physically near known people, that a modern life almost never reaches without significant effort. What both communities share is something researchers have started calling ambient belonging. Not active socializing, not deep conversation. The background hum of being surrounded by people who register your existence without requiring a reason for it. You are there. They are there. The nervous system notes the presence and quiets. Modern life is architecturally designed to eliminate ambient belonging. Private dwellings, private transport, private offices, headphones, individual entertainment delivered to individual screens. Each innovation that increased individual comfort and autonomy simultaneously reduced the background level of co-presence that the human nervous system processes as safety. The loneliness epidemic did not emerge from people becoming worse at connection. It emerged from the physical environment of daily life becoming structurally incompatible with the social conditions the human body requires. There is a version of this observation that becomes a simple critique of modernity, that we traded belonging for convenience and are now paying the price. The research does not quite support that framing. The Hadza and Tsimane communities are not experiencing a golden age. They face real losses. Infant mortality, physical danger, constrained individual freedom. The trade was real, and in many ways, the benefits were real. What the data shows is simply that something was lost in the transaction, and that the thing that was lost has a biological cost that was not accounted for in the price. The researchers who study this most carefully resist the pull toward either nostalgia or solution. Cacioppo spent the last years of his life arguing that loneliness was not a personal failure and not a medical problem requiring treatment. It was a signal, functioning exactly as designed, in an environment where the signal could no longer be answered by the conditions that originally resolved it. The nervous system sends the alarm. The architecture of modern life provides no corresponding exit. What the data cannot tell you is whether the architecture can be changed enough to matter. The experiments suggesting it can, intentional communities, co-housing projects, urban design interventions that increase passive co-presence, are promising and small. They have not scaled. Whether they can is a question the research holds open. Outside a Hadza camp at dusk, the fire is already going. People are arriving from different directions, settling into the space around it without announcement or invitation. Children move between adults freely. Conversation happens in the way conversation happens when there is no scheduled end to the evening, and no other place anyone is expected to be. The nervous system of every person in that circle is receiving the signal it was built to receive. Not happiness exactly, something older and quieter than happiness. The signal that says, you are here. They are here, and for now, nothing is missing. Most people reading this have not felt that signal in a very long time. Some have never felt it at all. And the tragedy is not that it is gone. The tragedy is that the body is still waiting for it.